New South Wales Health is embarking on the greatest digital transformation in a generation, and at the forefront is cloud technology. Now, we've all heard the term used, but what is it, and how is eHealth New South Wales using the cloud to transform the New South Wales health system? Let's find out together on Let's Talk eHealth.
Podcasting from eHealth New South Wales. This is Let's Talk eHealth.
Hi, and welcome to Let's Talk eHealth. My name is Daniel Hansen, Senior Program Manager of Cloud Transformation Services at eHealth New South Wales. In this episode, we will unpack some of the basics of cloud technology, like what it is and how our teams are using it to accelerate innovation, modernise service delivery, and drive better outcomes and experiences for both patients and clinicians. I'd like to welcome two guests from eHealth New South Wales joining me today. Director of Cloud Services, Adam Stanzione, and Director of eHealth's Critical Infrastructure Refresh Program, Michael Bogiatzis.
Thanks for having us. Appreciate it, Daniel.
Adam, let's start with you. Tell us about eHealth New South Wales digital transformation and the role that cloud plays.
Being the digital arm of New South Wales Health, eHealth has been on a significant digital transformation journey over many years. Things like bringing access to technology across the system, we've vastly helped support and contribute to the growing needs of healthcare, and also partner on innovations that we can help improving accuracy and the quality of patient care. For me personally, I like to think on my expectations as a citizen on the services I use, and I really do expect, I think with a lot of us now, to be able to access everything on a mobile device and all of our information to be instantaneous in any public and private service setting. I guess in this large healthcare system, digitization covers many areas across many elements, including a span of clinical and corporate areas of healthcare. But I think it's not also limited to technology. I think it includes people, process, and many of the business aspects that comes to a healthcare system. For me, personally, I see cloud as that being that digital enabler for New South Wales Health and the healthcare setting. For us, it enables to get access to a vast and modernised technology remit that we usually partner with our service providers. And this sort of enables us for our job to become less about building from the ground up and more about adopting, integrating, and leveraging technology.
So Michael, Adam mentioned just then that through cloud we get access to, a vast and modernised technology via our service providers. As the Director for the eHealth Critical Infrastructure Refresh, how does that impact the type of work you're trying to do?
It's fundamental to the work that we do. For those that have been around ICT for many years, we know that infrastructure refresh cycles are traditionally driven by capital investment. What that means is every 4 to 5 years, perhaps 7 if you're sweating an asset, we need significant amount of dollars poured into our environment to buy new servers, new infrastructure, run large complex programs of work to refresh that equipment. Also, then we can do it again in another 5 or 7 years. These building blocks, or cloud as it stands, that fundamentally underpins everything we do today in modernising infrastructure services, not just across government, but across industry. The buzzwords that you're going to hear a lot of, no doubt, in today's conversation that we all read in industry, such as scale, agility, elasticity, really do unlock and unblock infrastructure services and in the way that we go about our refresh and modernising services to meet business demand.
So it sounds as though this new technology is pretty foundational to the direction eHealth wants to take and the digital transformation. But before we go too much further, Adam, can you just help us out here? And can you quickly summarise what cloud really means in the context of New South Wales Health?
There is a lot of context in the use of cloud in New South Wales Health. And I'd first like to start with explaining it from a point of view around our existing applications and services that we deliver. And these are things like medical records and rostering systems, but in fact, there's hundreds of systems we deliver across New South Wales Health. And these systems do require equipment to run, and this equipment is commonly hosted in data centres. And the equipment itself has a life cycle, and then a big refresh activity is conducted to repurchase all of this equipment to maintain the delivery of these applications and services. Now, as part of our strategy, we have opted to, instead of buying all this equipment again in our data centers, we are partnering with the likes of Amazon Web Services and Microsoft Azure to rehost and transition a lot of these applications and services onto their platform to maintain the delivery of them across the state. What cloud services also gives us is access to capability and technology that, in the past would take us a lot of effort to develop. So not only does cloud services assist us with the refresh of the equipment supporting these applications, but it also allows us to scale with the consistent use and growth with the health system that is using these services or applications. Cloud services also enables us access to greater technology and capability than we've had before. So things like advanced analytics, where we can utilize to tap into our large data sets of clinical and corporate nature. These analytics can be used to provide better information to our staff across New South Wales Health, which also contributes to our improvement of patient care.
I'd really like to highlight that for the first time in its life, infrastructure has become the real rock star of technology, given the innovations of cloud. The times have passed where we've got engineers sitting in corners of data centers and computer rooms taking care of all the back office work, keeping all the lights on. They're gone. We're now the rock stars, the front runners, providing all the innovation, agility, scale, the U-Butte tool sets that ultimately lead to improved business services, and for us at New South Wales Health, better patient care. It's really high praise, Michael, and I could imagine that you'd get a lot of support from the application teams and the service teams that are no longer waiting on physical infrastructure to be ordered and implemented into the data center before they can even start installing. Having this flexibility and scalability means that it's so much quicker end to end. Adam, back to you though. Can you give us an overview of the journey that eHealth has taken to get to this point?
Definitely hasn't been an overnight journey. Our cloud journey starts the days of 2016. Where we're using cloud services in a often bespoke or a specific use case manner. The next phase of, our cloud journey is around the emergence of platforms. And this was largely around about 2019, where through establishment of some of our transformational programs, like what Michael is leading, we established a few key service platforms, being the New South Wales Health Cloud Service for Azure and AWS, and also our ServiceNow platform, which were quite pivotal in terms of our maturity uplift for cloud services. Preceding that was a lot about adoption and migration. Luckily, we established in 2019 and the 2020, when we saw the pandemic, we used these platforms, rapidly in our response to that, where we did some innovations and support. And second to that is just continually progress with our transformation and our migration of our systems from our government data centers into the public cloud services. Our journey hasn't specifically just been about technology, and a lot of emphasis has been back on ourselves as a business in terms of what we have to change into how we operate as an organization to leverage these capabilities, and also our people. And our people have been very central in this journey to date.
It's a really good point you bring out there about the people. Technology is fantastic and technology is one aspect, but what makes an organization actually provide as many benefits as they can and do the best work they can is that people aspect. So how has eHealth New South Wales invested in our people to help on this journey?
So what we did is we actually formed a digital academy. And to date, this digital academy has grown quite substantially, and which features a lot of other parts beyond cloud that is accessible to our staff today. But I guess during that time, and obviously on the topic of cloud, we did establish a cloud stream under that digital academy, which was one of the first streams that was established. And what we did is we set out to not just send people on courses, but we wanted to create a learning and development capability that brings context to the role that they will play in the organization, in the journey, and in the future. So as part of that stream, what we did establish is we established several learning pathways that staff could engage with in line with their roles or the work that they're doing as part of the organisation. But we also brought a community aspect to this learning development, and that was quite important too. So we've surrounded these learning pathways with also things like learning days, hackathons, and even establishing cloud champions. and having a community events as part of that. It becomes more than just go on a course and get industry certified. It creates a holistic learning environment that our staff can relate to the work that they're doing or the work that they're about to do, and also share and collaborate across the organisation to individuals. So it's almost self-sufficient in supporting and encourage a continuous learning environment for our staff.
I like what you pulled out there about a holistic learning environment. Anyone that's had any education background or training background understands simply reading a book doesn't help that much, and simply going and getting certified doesn't necessarily mean that you can do what the business needs to operate correctly and to implement and use the technology that you've been trained on. So it's good to hear that a holistic view of learning has been taken.
I just want to give a specific shout out to our training team that, really drives this forward and has been keeping it being a great learning and development or a great digital academy for all of New South Wales Health.
So it's obvious that eHealth has been on quite a journey over the last few years, and it sounds like it's really impacting the way that we operate. But Michael, what are some of the benefits that we've seen from some of the early transformation work that's already been undertaken?
We're going to have not just productivity improvements, which we have seen, but cashable. There are cashable benefits that come with these things, and the power of cloud does unlock capabilities that we would not have had in the past. So we talked about scale. We can turn things on, we can turn things off as we choose, and we can commit to either of the cloud providers. And what that means is, instead of ups and downs, we can say, well, we know we're going to use X amount of compute or X amount of storage over X period or Y period of time. And we can go and negotiate and commit better deals to that infrastructure where we don't need that scale and agility. But if we're building development environments or turning on and off training environments, it's not fixed. It's not running 24/7. So all that ultimately, which results in expenditure for ICT, can be far better controlled and optimized.
You've mentioned benefits like stability and agility and scalability, all those lovely buzzwords. But what are some of the other benefits that we've seen?
Ultimately, Dan, productivity and clinical hours back into the health system is what we're achieving through the transformation and use of cloud technologies. I'll give you a couple of really simple examples. Unplanned outages to systems and services. Just over the last 12 months alone, we've seen up to a 70% reduction. And that means that our systems and services are available for our clinicians more so than they have been ever in the past as a result of these technologies. 50% or up to 50% reduction in maintenance windows. The maintenance windows that we would have in the past have been massively reduced. So these systems and services have a far more availability today than they ever have. The benefits that came from the services that we're now progressing to cloud and the journey that we're on, ultimately you're putting more time back into people's day, less time on help desk, less time waiting for systems to be available, more time for them to complete their jobs and ultimately provide New South Wales health services to the citizens of New South Wales.
That's fantastic, Michael. And I really like what you said, because quite often technology can be removed from the end user at times, or it might be hard to see how what we're doing here impacts the lives of people. But one of the benefits of working for eHealth New South Wales is you can see that direct connection. And I love what you said about, putting the time back in the hands of our organisation to help improve patient care and deliver patient care to the people of New South Wales. So that's incredible. Well, that takes us to the end of the episode. Thank you, Adam and Michael, for joining me on Let's Talk eHealth.
Thank you for having us.
Thank you, Dan.
Thanks for listening to Let's Talk eHealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.